Is my DAG on the screen right now? Or in the meeting?
I'm right here.
Hey there. So I don't have the script that I'm supposed to use about public comment and phone numbers to call and things of that sort. Do you have that handy?
I don't.
Attorney General, we have it on the agenda, on the
Okay.
presentation.
All right, very good. Then I will read that as we do. Okay, I should have
And I
known
see
y'all.
it And I see it on the screen, so
All
that
right,
can
very
be.
good. All right, we've reached the 10 o'clock hour. We will endeavor to begin, assuming we have quorum. So I will call to order this meeting of the Cross-Sector Task Force to Address Overdose Joint Meeting of the Advisory Committee for Resilient Nevada and the Substance Use Response Working Group for 10 a.m. today, August 23rd, 2023. Would you please take the roll?
Okay, Attorney General Aaron Ford.
Here.
Senator Fabian Donate.
It's Donate.
Donate.
Yeah, you here, Fabian? Okay.
Okay. Senator Heidi Sievert Ganser. Assemblywoman Claire Thomas. Assemblywoman Melissa Hardy. Dr. Stephanie Woodard. Jessica Johnson. Lisa Lee.
Present.
Shayla Holmes.
Present.
Dr. Leslie Dixon. Christine Payson. Debbie Nadler.
Present. Thank you.
Jeffrey Iverson. Eric Schoen. Chelsea Cheatham. Steve Shell. Angela Nichols.
Present.
David Sanchez.
Present. Thank you.
Jessica Barlow.
Present. Good morning.
Brittany Collins Jefferson. Lenetra Grady. Ryan Gustafson.
Present.
Dr. Farzad Kamyar.
Present.
Carissa Loper. Dr. Carla Wagner.
Present.
Cecilia Maria. Elise Monroy Marsala,
Present.
Darcy Patterson, Pauline Sala,
Present.
Ariana Saunders,
Present.
Cornelius Sheehan, Jamie Ross, and Quinny Winbush.
This is Darcy
Thanks,
Patterson. I'm present.
All right, thanks, Darcy. And
Mhm.
Senator Donate said he was going to be joining as well. Are you on yet, Senator? All right. He said he'd be joining soon. Senator Gansert said she will not be. Who was the other assembly person that you mentioned? I don't have Hardy's number, so I can't reach out, but who was the other?
Claire Thomas,
Okay. I'll reach out. Okay, do we have a quorum as it stands?
For the record, Jessica Johnson also joined.
Thanks.
Good morning, everyone. Present.
I'll let you tally, see if we have a quorum.
Attorney General Ford, this is
Yeah.
David Sanchez, Chair of the ACRN. It looks like
Yes, sir.
there's a couple of people that are here that the administrative team is working on getting accounted for the roll call.
Okay.
Just
Then
another minute or so.
All right, that's what we'll do. We'll give it a couple more minutes and let them figure this out, and we will proceed once we know we have quorum.
For the record, Senator Donate is here.
Thanks.
Also Carissa Loper.
Great.
that would establish quorum.
Very well. Okay, then we shall proceed. Thanks, everybody. Great to see you all, quote unquote, see you all on the screen here. And welcome to this meeting. Let's move to public comment. And I'm going to read what's on the screen here once it comes up. Our public comment. Public comment will be taken during this agenda item regarding any item appearing on the agenda. To provide public comment telephonically, dial 775-321-6111. When prompted to provide the meeting ID, enter 235-433-998#. In consideration of others who may wish to provide public comment, please avoid repetition and limit your comments to no more than 3 minutes. No action may be taken on any matter discussed under this item until the matter is included on an agenda as an item on which action may be taken. Is there anyone for public comment? I see a hand raised, but I can't see whose hand it is. Can y'all help me out with that? Can someone help me out with that? Oh, I see it's
Attorney
Debbie.
General,
Yeah.
you have Debbie.
All right, Debbie, go ahead.
Hi there. Good morning to everybody. It's just a public comment. I understand that, but I'm hoping we could discuss this. Unfortunately, I've had an episode happen, an incident happen that involves my son's best friend. He is getting prescriptions through a drugstore here continuously. I had to call the PMP, the Prescription Monitoring Program, and I had a long talk with them this past week because he is actually going through a doctor, getting medicine, hopping from doctor to doctor, but getting him refilled at the same pharmacy. come to find out, and I didn't know this, and I thought our state had a red flag system or something in place that would alert the prescribers, the pharmaceutical companies, if somebody was abusing a drug. I found some paperwork, and I'm seeing that it says integration is not mandatory through the PMP. And this is one particular drugstore that I believe we did sue. It was part of our lawsuit. Now, I come to also find out that California has a system in place called Cures, C-U-R-E-S. And what that does, it tracks all the prescriptions, what's prescribed, how much is dispensed, tracks the sources, and everybody is required to take part of it. It's not just the doctors, it's the pharmacies themselves. Furthermore, California is doing this alongside Oregon. And we are such a close state to California. I mean, half of California residents come here for the weekend. And I'm not exactly sure why this is something we are not concentrating on, because this is how this started in the first place. And to bring it to my front door is just very disturbing, to say the least. And I know it's just public comment in here, but I wanted to get down for the record because perhaps it's something at a later time we can discuss. But yeah, I wanted to bring that forward today. Thank you.
Well, thanks, Debbie. I'm sorry to hear about this. We appreciate you bringing it up during public comment. You know, we can't take action on it, but I would suggest you follow up offline to ascertain what, if anything, can be done to assist in this arena. Okay. Feel free to reach out to my AG's office, and we can look into that.
Okay.
Anything,
thank you.
Anything further for public comment? I have been authorized by Senator Gansert to share the great news as to why she's not here. Her daughter just had her baby a few days ago. So she said that the baby's name is Edon. So Edon Jacob Agam, 8 pounds, 1 ounce. So if you know her or are able to connect with her, send her some congratulations. And I have been informed that Clara Thomas will not be able to make it. She's at a veterans treatment graduation. So that's for public knowledge as well. Okay, final call for public comment. Any further public comment? Hearing and seeing none, then we will move on to agenda item number 3, which is our welcome and informational review of objectives for cross-sector task force to address overdose. I am going to defer to Mr. Sanchez to give us a review of the objectives for the cross-sector task force to address overdoses. Sir, mic's yours.
Thank you, Attorney General. This joint task force will determine necessary action to reduce the risk of overdose in Nevada's community. We'll prepare responses for the state and local jurisdictions in the event an increase in overdoses occurs. We'll also aim to provide technical assistance, guidance, and resources to rapidly implement best practices to reduce the risk for overdoses and enhance capacity to respond to these types of events. We also also respond to such overdose events when they occur by holding these meetings. Again, these are the objectives for this cross-sector task force, and we really hope that the subject matter experts in this group can bring forward issues that they see across the community to kind of highlight and bring them forward as a target so that we can place them as actionable items that this task force can move forward on. I believe that is all I have for this one. Yes, that is everything I have for this one.
Great, thanks. I may have one other piece of information to share in that regard. I just need to search my notes here. So the cross-sector task force has been allocated $500,000 to achieve these short-term goals. So keep that in your mind. Garrett and Don are the DHHS staff assisting us with the meeting, and we are grateful to have them here. So keep that in mind. Thanks so much. Anything further from you, Mr. Sanchez?
Not at this time. Thank you, Attorney General.
Great. All right, thanks so much. Then let's move on to the next agenda item. For possible action is a discussion and vote to approve the minutes of the meeting of December 13th, 2022. Those meeting minutes have been distributed. I hope you've had a chance to review those. I will give a couple of minutes to do that as well, but I will entertain a motion to approve the minutes. Lisa Lee.
Attorney General Ford, Lisa Lee, for the record, I'd like to motion to approve the minutes from our December meeting.
Ms. Lee has moved to approve the minutes. Can I have a second?
This is Elise. I will second the motion to approve the minutes.
Elise, say your last name, I'm sorry, for the record.
Sorry, Monroy Marsala.
Very well. So moved and probably seconded that we move, pardon me, that we approve the minutes from the December 13th, 2022 meeting. Any discussion on the motion? Hearing and seeing none, all in favor say aye. Aye.
Aye.
Aye.
Aye.
Aye.
Any opposed, say nay. Any abstentions? Motion is approved unanimously. Thank you so much. Moving on to agenda item number 5 for possible action as well. We will have a presentation, a discussion, and vote to approve the task force action plan topic on leveraging programs. And Mr. Sanchez, I turn the mic back to you.
Thank you, Attorney General Ford. At this time, I have a presentation that I put together as a subject matter expert for this task force and part of the Advisory Committee for Resilient Nevada. Next slide, please. So this slide is, this presentation was put together by myself as part of a how do I say it? Part of my work with the Advisory Committee for Resilient Nevada. We broke down some sections that were topics that the committee would like to look into as far as being part of this task force. So the section that I got, that I was delegated, was leveraging existing programs and funding to develop outreach response providers and personnel that can respond to any overdose or suspected overdoses and offer follow-up support and referrals. This recommendation included connect people leaving from jails, prisons, and post-release treatment, housing, and other supports as well to educate about overdose risks. A little caveat with this one, the presentation is sort of directed towards crisis services, but I would just ask that the task force also consider how these slides can be implemented specifically to overdose outbreaks in our state. Next slide, please. So the target population and goals for that I brought up here are, back one slide, please. Oh, never mind, my bad. We're good. To utilize existing community providers and personnel that can be deployed to support anyone being released from an institutional or community setting. For example, hospitals and jails and prisons and other institutional settings like inpatient rehabs or behavioral health inpatient settings. And this is to kind of keep an eye on them as they're being discharged or support them in some type of way if post-release overdose is suspected or a possibility. This presentation aims to address the needs for leveraging existing programs, and these providers and individuals ought to be equipped to respond to any suspected overdose and offer follow-up support, referrals, and services to the affected individuals and their loved ones. Next slide, please. If we look at provider buy-in, so the providers that we have for substance use services and behavioral health services in Nevada. The big thing that we need here is to figure out how to get these existing local agencies and providers to commit to responding to community overdose events. And I think that starts with like a foundational approach of post services, exiting services, providing resources, referrals, or just even naloxone in and of itself as folks leave these settings. Some possible contributors would be local EMT service providers, which it is true that EMT services and law enforcement have naloxone after they engage with a community member who may have issues with opioids and be at risk for overdose. But the intent here is to get this task force involved with ensuring that those service providers that work with the community can have what they need to support them if overdose is a possibility. Next slide, please. So this one was hard for me. I kind of didn't really get a solid grasp on how this would be enacted, but collaboration between local CCBHCs, hospitals, EMT services, and 911 dispatchers. These first response systems, in cooperation with established mental health and substance use treatment providers, basically provide the infrastructure needed to respond to overdose. How do we get them to begin a cooperative agreement and implement programming that would answer overdose outbreaks sooner rather than later? And so during this presentation, I would ask that members of both committees and this task force as a whole to feel free to jump in and add your experience or subject matter experience in order to kind of help this task force come up with some ideas on how this might be done. Again, as the Attorney General mentioned, this committee does have $500,000 at it's ready for us to put into the community where we can find places that might support overdose events and the after effects of that, if we can, also before that event. Again, I mentioned
Mr.
CCB.
Sanchez, just real quick, but do you want to take questions at the end, or do you want to take them as the hands are popping up now?
Ooh, good call. Thank you, Attorney General. Let's take them as they're popping up now.
Okay, so I
Do
see,
you have a first?
yeah, I see Shayla, and then Elise, and then Debbie.
All right, great. Shayla?
Thank you. Shayla Holmes for the record. On your previous slide, and I think those were questions as far as how do we begin a cooperative agreement, or how can we begin to build this infrastructure? I think there's really opportunity to leverage our regional behavioral health policy boards here as the coordinators that work in those regional behavioral health, those behavioral health regions. Those coordinators have been doing this type of work with these partners for several years now at this point in time. And I know in the northern region, each of our local counties have task forces dedicated to behavioral health that bring together these partners already. So I think there's a lot of this work happening that can be leveraged, and particularly through those coordinators and those behavioral health boards.
Awesome. That's great information, Shayla. And yes, I imagine that there's plenty of people on this task force that can give us that kind of information. So I really appreciate you raising your hand and speaking forward to that point. And so that will help solidify how this committee or how this task force can show up at one of these policy board meetings or behavioral health committees and say, we are here, we're present, we understand the need, and you guys are kind of the infrastructure already established. How do we help in this situation, specifically when we see a bunch of overdoses? Elise Monroy?
Thank you, Chair Sanchez. So just a comment on this lead agency point of contact slide. I believe that many or most communities in Nevada already have a spike response plan in place. I know that that was part of like the OD maps build out. Clark County has one, Washoe County has one, Douglas County has one. So there might already be, in some of these communities, there might already be a structure in place for a lead agency point of contact. So we might want to the first question is, do communities have spike response plans? Have they done a test of them? And who is the lead agency? The next thing, I think it was interesting that you noted, how do we get providers to commit to respond to spike incidents? The OD2A grant actually just yesterday released the findings from a harm reduction study they did. And I'll make sure that that gets to the surge and the ACRN. But one of the interesting findings from the provider survey they did was that providers surveyed, many of them were actually unwilling to provide harm reduction services or education to the communities or the populations they serve. So I think that will be a barrier. But Nevada has CCBHCs, which are Certified Community Behavioral Health Centers, which as a requirement, it's my understanding, as a requirement of their CCBHC status, they're required to take people in crisis. I think that there's some question based on other calls that I've been on 988, if that's actually happening, if they are taking people in crisis. But I'm hoping in terms of buy-in, having those facilities that actually the governor just in his budget approved increasing the number of CCBHCs will be able to get buy-in, because as a requirement, they're required to take people in crisis. The last thing I'll say is I would just caution the committee against putting too many eggs in the basket of all of these committees that are subject to open meeting law, because at the end of the day, this committee was convened to respond to a very severe spike incident that happened a year ago. And because of open meeting law, which is important, we weren't able to be nimble. So I would just challenge this committee to think about ways that we could use the $500,000 investment outside of supporting initiatives that are tied to these kind of bureaucratic committees. So thank you for the leeway there with my comments.
Absolutely. And thank you so much for your comments, Elise. Well put. And I think that's exactly, there's just so much good stuff there. And so I will put a parallel to the CCBHCs are being presented currently as they're ready to deploy their crisis mobile teams at any moment. And that is not actually true. Through research of my own, through my different roles in the community, there's a couple of them. If you call on the weekend, you leave a message with an answering service and they'll get back to you on Monday, unless you're already a current person who gets services through their services. And so although that's not established quite yet, the hope is that we can somehow tie overdose response, even post-overdose response, to these mobile crisis teams through the CCBHCs, and either get them to do a leave behind program where they leave naloxone, communicate with the family, support the family, or at least just get some type of support towards this community. I appreciate it. Debbie Nadler.
Thank you very much, Debbie Nadler, for the record. I have a question for you on slide 1. If you could go back to slide 1, if you don't mind. It was to provide services. I'm so sorry. It's probably slide 2. Oh, no. Okay. Let me just say what I'm trying to say. Where you're talking about to follow up support and services for those that have overdosed and the family members. Are you talking about those who overdosed and lived, or those who overdosed and did not? Because there is no support right now for the bereaved family members who have lost a loved one right now.
Right.
I'm curious if that is what is included, if you're referring to that as what you're talking about, any kind of services.
So what I'm specifically talking about for this task force is for the person who overdosed. But Debbie, I appreciate you bringing that up because this is a group of folks who work with the target population of folks affected by opioids in some type of way. So being that you're bringing that up to this task force and all of our different connections to the community as it pertains to behavioral health is beautiful, is perfect, is well said. I'm glad that you brought that up. And I hope that this can put it on people's radars who work with the population to come up with some ideas and some plans, pitch it to your directors and your programs to get support for the families. So as far as your question, what am I talking about specifically? I am not talking about specifically the folks that are left bereaved after someone dies, but I would be talking about follow-up support for overdose that is survived for families, the individual. Again, Debbie, we have the 500,000 that this task force has been allotted to put into the community to respond to overdose. And I don't mean to be insensitive. I just mean that this committee's funding and goal and target population can only do so much, right? Of course, go ahead.
I'm sorry for interrupting. I guess what I'm talking about is the domino effect on family members. Many siblings will become, excuse the expression, will suffer from addiction after they've lost a sibling. And we've seen it happen all across the country. It's a domino effect. So if there's no support, and I've seen grieving moms become, suffer from substance use and suicide. So if we're talking about preventing it from happening and supporting risk of overdoses, I think it's very important that we help the family members and all those who have been affected by it. And that's my thought.
All right. Absolutely, Debbie. Thank you so much for your comments. And I really ask again that the committee members take this forward as they work with their communities in the different ways supporting this topic. Lisa Lee.
Thank you, Chair Sanchez. Lisa Lee for the record. I just wanted to comment that in this particular presentation, it's all about systemic involvement. And it's been my experience that the people who are saving the most lives with overdose reversals are people who use drugs that happen to be there at the time that someone else is using, and they're able to save their friend by reversing their overdose. The people who are showing up in our death data are dying alone, and they're largely housed, right? And it's likely that they're not hitting all of these touch points in the system. They're outside of that. And so I guess the real challenge here, right, because we have tons of funding that's going towards people experiencing homelessness, which is awesome, but they, in the death data, the people experiencing homelessness represent a very small portion of people who actually have a fatal overdose. And there are probably multiple reasons for that: systemic involvement, community members who have naloxone and encampments that are able to respond. Again, they are the first responders, right? But what about all of these people that are dying alone? Maybe they're bystander, there's a bystander there, but they don't have naloxone. We see that in the overdose data, right? So I really want to be able to use these data, as well as anecdotally, my friends that are dying left and right are dying alone. And so, and they're not involved with CCBHCs. They're not going to the hospital when they have an overdose. They're not calling EMS. They're saving each other in lieu of these systemic interventions. And when they're not able to save each other, they're dying. And so I guess the real challenge is, how do we utilize funding to get into these spaces with people that are not touching all of these programs and institutions, right? That's the challenge. And I think vending machines are a really good way to get into communities that don't have these systemic involvements. where people are able to, go and utilize these in a way that doesn't out them as a person who uses drugs or whatever. It's kind of a barrier-free touch point for getting naloxone out there. I know that Black Wall Street and Wake Up Nevada have newspaper stands like Chad Sabora in Missouri. They kind of adopted that model, the Naloxy box, Naloxy boxy, I think he calls it. They're utilizing that model here, and they have them in a lot of really like hotspot areas where there's a lot of substance use. And so I think we can be creative, but I just want to be mindful of who is dying, in what circumstances those fatalities occur, and not, I mean, CCBHCs get a ton of funding, like all these places get a ton of funding, and yet the people who are dying are probably not utilizing any of them. So just wanted to bring that up, and also we need to talk to people who use drugs about what is occurring, because they know more than anybody, right? Because they're actually doing the reversals all the time. Thank you.
Awesome. Great points. Thank you, Lisa. I appreciate your comment. And again, this goes to the whole of the task force. Please keep in mind the comments that are being made by the subject matter experts in considering what not only this task force can do to help, but also the different roles we play within our communities. Dr. Wagner?
Hi, thank you, Carla Wagner, for the record. I have a quick follow-up to Lisa's comment and then a couple of things to respond to what Debbie was asking for. So since we're here and on the record, I just wanted to offer Debbie, there are multiple national level organizations that are specifically designed to support parents and families around grief and recovery. So I just wanted to mention them here so that people know about them. The first one is called GRASP, Grief Recovery After a Substance-Related Passing. Second one is called A New Path, PATH, Parents for Addiction Treatment and Healing. The third one is called Shatterproof, and they specifically provide family-based education and grief support. And the third one is called Broken No More, and they also provide support for families and grief recovery. So I just wanted to make sure that everybody was aware that there are these national organizations, and I know that there are people in Nevada who are affiliated with them. The second thing I'd like to say in relation to Lisa's comment is that my research group at UNR is just about to enter the second year of a 5-year NIH grant that is specifically designed to talk to people who use drugs who are responding to overdoses in the community and learn from those folks about what they need. So we are about to launch a study where we'll follow a cohort of 300 people for a year to learn from them about what they're doing, what they need, and how we can build programs to support overdose responders, and how that act of taking up the role of being a first responder in your community impacts people's own mental health and well-being. So, this is an NIH-funded study. It's a long road. We're not going to have data for probably another year and a half, but we are working on that and funded by the NIH to do it. Thank you.
Thank you, Dr. Wagner. And thank you for your continued work in the community and bringing to light the services that can support families as national programs. Good point to get that on public record, and hopefully that can go towards filling in some of the information that Debbie was looking for. Jessica Johnson?
Hi, everyone. Jessica Johnson here. I'm the surge prevention chair. So I wanted to just include for the record here, as we're thinking about these systemic type issues in our July 2023 meeting, the full surge heard the draft of the harm reduction recommendations. And one of those was looking at increasing support for harm reduction based post overdose outreach in collaboration with many of the systems that you mentioned, including wraparound services for surviving family members, and also engagement in post-mortem services for families. So I wanted to mention this as it is a recommendation that the surge has been considering and is in draft form now. So taking notes on my end about this, but wanted to just make sure that that parallel was also known. Thank you.
Great. Thank you, Jessica. I appreciate your time and comment. Debbie, one more time.
I'm sorry. Thank you so much, Debbie Nadler, for the record. Lisa Lee, fabulous point you just made. And in correlation with that, I was thinking about the Good Samaritan Law. So many kids don't know about it. There's no billboards, there's no PSAs. And Lisa is correct. What I believe there was a study done where 95% of all those using are using with friends, but yet 95% are found alone. These kids get scared, they run. My son was deserted. So many more were. We've got to do, in my opinion, we need to do something with the Good Samaritan Law. Many states are taking action on it now, doing the PSAs, putting out billboards, letting the schools know, talking to the children, letting them know, please don't run, call 911. And I think that's imperative. And Lisa, that just triggered that. Thank you so much.
Thank you, Debbie. I appreciate you stepping in and speaking to the topic. I appreciate your comments. Lisa Lee, one more time.
I'm so sorry. Thank you, Chair Sanchez, for your patience with me. Lisa Lee for the record. I would also like to reiterate that I know when that bill passed, it was, I was still at Change Point, and we were Change Point is the local syringe services program up here in the north. And we would give that out on a card, right? And I still, when I do syringe distribution, I still, have that card and try to tell people about the Good Samaritan Law. But I will tell you, there is such a long history, and especially right now, like, I know that the drug-induced homicide law is being resurrected in a lot of places, and it's causing a lot of fear. And my fear is that people will start abandoning their friends. They will start throwing them off balconies, in dumpsters, leaving them in cars, etc., just like we used to see in the old days. I mean, I myself am here today. I experienced numerous overdoses, like all the time, and I am only here living my life that I live today because of people who use drugs, because I never called 911. No one ever called 911. All the overdoses I reversed, we did not call 911 because of the risk, right? And so I remember my dad saying, I jump out of my skin when the phone rings because I just know it's the police calling to tell me that my little girl has been found in a dumpster, right? And that's just kind of the reality of substance use and parents of people who use drugs, that living in constant fear that their child is going to be abandoned. So I do think that we could do better with messaging about the 911 Good Samaritan Overdose Act. And at the same time, we need to be very clear about that, which path we're taking. Are we resurrecting the drug-induced homicide law? Are we going after people if those drugs have fentanyl in them and people don't know, or they do know? I mean, what are we doing? Because that conflicting messaging is driving a lot of fear with, again, getting systems involved. And I was one of those people. I avoided all the systems that you're talking about in this presentation. Almost a decade of drug use and homelessness, right? I was like not going to the hospital, lancing my own abscesses, right? There are people who live in fear of stigma, shame, and punishment. And so I want to be really mindful of that, and also really clear if we pursue messaging around it's okay to call 911 when your friend is overdosing, and it's okay to do that, right? Because I think we do have a few conflicting messages happening right now. If I'm confused, they're confused. Thank you.
All right. I appreciate all of the back and forth in the conversation. It's very important. We want to ensure that we can get through our agenda. So I'm going to jump in real quickly and just remind folks, see if I can keep our comments a little brief. I do want to acknowledge, however, that the Surge Committee, and Alyssa, you would remember this, we've already recommended a public awareness campaign for the ability to call 911 under the Good Samaritan Law. And so to the extent there's an opportunity to coordinate with Acorn, maybe there is an opportunity simply right now. I mean, look, this is easy. I say easy. It's easy to reach out to folks for public service announcements and start this program. There's no need to tarry on this. And so I just think at the end of the day, we need to get moving on that. That said, I do see one more hand up, and let's make this the last one for now so that he can move on with his slides, please, and then we can go from there. Shayla.
Thank you, Attorney General Ford. Shayla Holmes for the record. I did just want to highlight that on the Surge Community Response Subcommittee, we are working on a recommendation to reconcile and address the Good Samaritan Law and the drug-induced homicide law. And we have made the recommendations, as Attorney General Ford mentioned, for the campaigns. And so we have not abandoned that, and we are continuing to work on that, and we'll be pushing a recommendation forward to the larger Surge.
Thanks so much. Mr.
Right.
Sanchez.
Thank you, Attorney General, and thank you for the comments, committee members. As we move forward, can we go forward one slide, please? There we go. If we look at the CCBHC infrastructure, as we talked about, these are the services that they offer, and it seems like this committee is familiar to understand what that involves. Can we go to the next slide, please? So if we look at hospitals and EMT services in Nevada, Carson Tahoe Hospital has Mallory Behavioral Health Crisis Center, and I don't know if the crisis receiving it is a crisis receiving and stabilization center now. Renana has plans to open a crisis stabilization center. These are all part of the plan for behavioral health in our community, and just information that I put together kind of as best I could. Can we move to the next slide, please? So from my point of view, and one thing that I struggle with is EMT services. How can this task force get in cooperation with EMT services to incorporate peers within the overdose responses, respond without law enforcement accompaniment unless special circumstances warrant that type of inclusion? And I believe that this will help make sure that there is a scheduled outpatient follow-up for folks that have experienced overdose. And then we have at the bottom, we could also implement real-time GPS technology in partnership with the region's crisis call center hubs to support engagement with folks that have experienced overdose. Next slide, please. So incorporation of services, triage and screening. So basically anybody that's out there in the community that is responding to overdose, and if we look at the comments from Lisa Lee, not the entire population of folks who use drugs or overdose or are at risk for overdose work with these services, but for those that do, how can we incorporate these functions to those teams responding? And a big one for me is the leave behind concept of making sure that these folks have access to and are handed naloxone as they work with the response teams in our state. Next slide, please. Woo. So we did a lot of talking during the presentation, and really, again, I was tasked with bringing forward a presentation on leveraging programs, and as a subject matter expert on the ACRN, I'm kind of limited in the knowledge that I have. But I guess what I would ask as we get comments and questions moving forward for this presentation is that we have $500,000 to spend towards these short-term actionable plans. To me, that seems like a one swing type opportunity to respond to these opioid overdose spikes and in our communities, and respond to somehow support folks that are going through that. When you hear that, when you think of that, what's that one swing, one attempt to look like? What do these short-term goals look like to you? And I don't want to take up the entirety of the meeting time, so I have Jessica Johnson with her hand up.
Yes, thank you, Chair Sanchez. Jessica Johnson, for the record. Again, I appreciate you bringing a very complicated topic to the table today for our discussion. From your comments regarding work with EMTs and other opportunities to intervene in potential non-fatal overdoses. I also just wanted to elevate that the 2022 surge recommendations included a harm reduction recommendation number 8 Part B that was modeled after Maryland's STOP Act, which passed in 2022, and that looked at authorizing emergency medical service providers to do naloxone leave behind, to dispense naloxone to folks who were receiving treatment for a non-fatal overdose or to those evaluated by a crisis team. It also required certain community programs and private and public hospitals to dispense naloxone free of charge to individuals who were in the hospital for circumstances related to overdose. So potentially, to your earlier comment, folks who are maybe touching the existing system, just wanted to include that recommendation from our 2022 list. Thank you.
Thank you, Jessica. I appreciate it. And that's awesome to hear. Again, if we look at it from the perspective of this task force to respond quickly, which we're not able to do so nimbly as Elise put because of the bureaucratic side of this committee, keeping all that in mind, I'd love to come up with some actionable plans, short-term plans that we can initiate if we see another spike of overdoses. Dr. Wagner.
Hi, thank you, Carla Wagner, for the record. I have sort of a comment that leads to a question. In 2016, I was a member of the MPAC, the Multidisciplinary Advisory Prevention Committee, I think it's called. And that committee was convened after passing the naloxone access and 911 Good Samaritan Law. And I am looking at recommendations that we wrote in 2016 about public messaging campaigns for the 911 Good Samaritan Law, when that was a new law that was passed in 2015. And so my question is, I've been sitting on these committees now for 7 years, making these recommendations, and all of the things you're saying, Chair Sanchez, are things that I know you and I have talked about and that we have talked about over the years. But how do we move from making recommendations that end up in a document on my computer to actually doing the thing? Like, what power does this committee have to take the next step? Because I already wrote those campaigns in 2016. And we still haven't seen them. So how do we get to the next step, and how can we leverage our resources here to make that happen?
Awesome points and great question. And just what's that feeling of I don't know how to say it professionally besides dang. I mean, yes, we have a group of really smart people, really invested people who have worked in this behavioral health field in Nevada for years and decades. And the point that you bring forward, how does this specific task force go ahead and pull the trigger on releasing the funds and getting help to the folks that need it most when there is an outbreak of overdoses? I'm not sure, but hopefully we will find out over the next hour.
Well, I have an idea. I have an idea. We're just gonna do it. Look, if we are serious about a public information campaign, let's just do it. My office can take the lead on reaching out to media outlets, TV, radio, and other outlets that you all have suggested maybe in your past, because this happens all the time. People make recommendations and they get ignored, right? So let's just do it. If that is one that this committee wants to do, the public information campaign on the Good Samaritan Law, then I think we can vote on that, and I will have my team working with Terry and others to effectuate that in short order. The second thing was, I heard Lisa mention, I don't know if we can do this part as nimbly or as quickly, but she talked about the vending machines, and I don't know where that falls in the spectrum of controversy, but at a minimum, the public information campaign is a lot less controversial, especially because it's based on the law that exists. I see people shaking their head no, but here's the fact. It's in the law that exists right now that allows us to go ahead and do that. And I'd be happy to take the lead on doing that. But I need, I guess, an affirmative. I'm looking for my my DAG to be certain that I can just simply right now take a motion to proceed on the public information campaign, or do I need to put that on an agenda and make that a specific vote How do I facilitate that, Hina?
General Ford, I actually would recommend that it be a specific item on the agenda.
Okay. So I see a whole bunch of hands come up, and that's cool. But I'm just saying, if y'all want something done, we got $500,000, which is a limited amount of money. You have a willing participant in the AG's office to take the onus on ourselves to move it, and we can start doing that. So let's hear what everyone else has to say. And Mr. Sanchez, if you're okay, we can wrap this one up after these last 4 questions come out, move on to the next agenda item. But see if we can come to a resolution on that particular issue and as to whether or not I should put it on an agenda item for our next cross-sector meeting to make it happen. With that, please keep your comments brief, everybody. We have Elise, Jamie, Jessica, and Debbie.
Thank
Elise.
you, Chair. So, or AG Ford, thank you. So initially I had a question, which was, are we going to be pulling the trigger on spending money today? It doesn't sound like that's what we're going to do, but I'm so excited, AG Ford, to hear your commitment to doing a messaging campaign. I did shake my head at it being controversial because the way for this messaging to be impactful is to be controversial. So the OD2A grant just piloted a harm reduction messaging campaign that hit a couple snags, which I'm happy to share lessons learned. But we partnered through the OD2A grant with a drag queen called Coco Montrese and a sex worker who makes spicy OnlyFans content to message about safe use and harm reduction strategies. We got organic reach that I have never seen in my life on a public health campaign. The Chantal's video got 100,000 views and 75,000 shares. In order for a messaging campaign to be successful, we can't place through Nevada broadcasters. We can't place on TV. We have to use people that look real, that don't look like actors, that aren't wearing white coats, and that are talking to the people who are using drugs and saving their friends. So I am happy to hear that there's commitment to pull the trigger on these funds. And Dr. Wagner, to your point, the reason why those recommendations sat for 6 years was because until the state had settlement dollars, we had no way to spend money nimbly. Nevada has been overly reliant on categorical grant funds to do our work, but now we have an opportunity and a great champion like Aaron Ford who can help us pull the trigger, but we have to be willing to look beyond billboards, beyond what can go on a PSA, and we have to talk to people who are using, and we have to pay people who probably are using to talk to other people who are using. So that's all I have to say. I'm so happy to hear that there's commitment to move forward.
All right. Thank you for that. I'm going to take a note here and circle back. I want to get everybody else's comments in first. Jamie?
Thank you so much, Chair Ford, or Attorney General Ford and Chair. I wanted to echo what Dr. Wagner had said. I remember sitting on the MPAC in 2016 and those recommendations, and I want you to know that it is very possible that the state was unable to move forward for that, but almost every substance use prevention coalition in the state of Nevada did grassroots media messaging campaigns up to and including on the UNR and the UNLV campus, working with national media companies to ensure placement. So one of the things that has been really effective historically, because our state agencies are unfortunately unable to be nimble, but there are multiple grassroots agencies that are funded through these state dollars that have historically been able to do that. And to, I believe it was Elise's point, the coalitions did pull back on Good Samaritan messaging because there was the conflict, and we did not want to ensure, or we did not want to exacerbate a problem because of this. So this is something that we did for literally years, and then we pulled back because of those issues. And happy to work with the offices, send the messages that had already been created. Obviously, they're probably a little bit outdated now, but we'd be happy to work with any agencies to ensure that those messages reach their intended audiences. Thank you.
Thanks.
Thank you, Jamie.
Jessica?
Hi, everyone. Jessica Johnson for the record. I wanted to circle back on the earlier point made about vending machines as a strategy for naloxone access and other types of harm reduction supplies. Chelsea Cheatham, who's a subject matter expert on the Surge Committee, has been part of the leadership of many of those efforts across the state of Nevada. So not to put Chelsea on the spot, but perhaps a future cross-sector task force meeting could feature some of the lessons learned and some of the opportunities for engagement that she could lead, or bring other folks in who could also lend voice to what that might look like in terms of initiatives to move forward. Thank you.
Thanks, Jessica. Debbie?
Thank you, Debbie Nadler for the record. Just real quick on what Jessica was saying about Narcan, just a real quick point. I know that it's not mandated in our school systems that all schools carry Narcan, and it's not mandated because of one word. It says shall instead of must. So, and I know this because I called the schools and I found out who's carrying it and who's not. So it's just a simple wording in legislator in that bill. It says shall, and it's not must. But back to the Good Samaritan, the billboards, the PSAs, and I know we did it. I looked it up. We did it during, I believe, Governor Sandoval years ago, and I watched some of the videos. I happened to watch them this weekend, and they were intense. It was a lot of, unfortunately, grieving family members who got on and did the PSAs and did the messaging, you know, who explained about you let your friend, you ditched your friend, you know. Long story short, whatever you need me to do, I will be glad to do anything. I am all for this 100%. I think we can save a lot of lives, a lot of lives. Ohio's doing it right now. If anybody wants to look it up, they've got a big campaign going with the Good Samaritan Law. Thank you.
Thanks, everybody, for your comments. If I could, Mrs. Sanchez, before to give you the mic back to close out. I think I've heard enough on at least what sounds to be like a consensus on the PR campaign. What we don't have consensus on is what the message looks like, what venues it will play on, and things of that sort. So the devil or somebody's in the details, and we need to figure that part out. Here's what I'm more than happy to do. My notes say we should likely put an agenda item on on the very next meeting related to the PR campaign so that we can vote on it. We need to, in my mind, convene a small committee, a small subcommittee, to help us develop the scripts, determine what venues and outlets we're going to utilize, whether it's YouTube, whether it's TikTok, whether it's billboards, whether it's holistic or whatever. We need to determine like some participants. You know, we talked about people who use drugs. We talked about family members who are grieved, and then a real timeline for when we want to get this done. And I'm more than happy to facilitate that from the AG's office. But I just want to be certain that we understand that if time is of the essence on this, we're gonna push it. My office will push a timeline to make this happen sooner rather than later. On the vending issue, I think we still need to kind of determine you know, where the authority lies for us to spend money on that. It may very well allow it us. I mean, we may be, but I need to circle back and just determine that statutorily we can do something like a vending machine out there. But this one, I'm not worried about the PR. So with that, let me give you the mic back. So I saw Carla, you can be quick on this one? Go ahead.
I can be very quick. Thank you. Carla Wagner for the record. I just want to recommend that if we are talking about a public messaging campaign around the 911 Good Samaritan Law towards people who use drugs or people who are reversing overdoses, and especially Attorney General Ford, if it's going to come from your office, and thank you so much for championing this, a parallel campaign to make sure that all of our law enforcement officers are educated about what the law says and how they should or should not enforce is going to be really important, because we can increase awareness among people about this, but if they don't trust how the law is going to be enforced on the ground, it's not going to work. And I think you have a particularly excellent place of leadership to do both at the same time that could be really effective. So thank you for championing
Well,
this.
your point is well taken, and I appreciate that. Probably is a parallel track that we run on the education piece on that. And by the way, it doesn't have to be run by my office. I'm happy to spearhead it and facilitate it. You didn't even got to mention my name. I just wanted to be certain that we can move this thing forward. So with that, Mr. Sanchez closes out on this item, and we can move on to the next.
Thank you, Attorney General. So just so that we're aware, this is an actionable item. So if this committee wants to commit to moving forward to put together a subcommittee that can kind of do the work needed to come up with what it looks like to bring this public service messaging forward, I think that, I don't know if we have to vote on it or not, Attorney General, but if we need to, now's the time to say, let's get a vote on the floor to convene a subcommittee to kind of shell out what we need for public service messaging and then bring that forward to the next meeting.
Hina, can I do it? Or do I need to agendize that next meeting?
That would need to be agendized as well.
Okay. All right. So I'm going to make an executive decision and say next agenda, and we can have this meeting as soon as we need to, frankly. Let's put this on the agenda. Let's make an item for this so we can vote on subcommittee, maybe make some appointments to the subcommittee, give, at least some guidelines on what the committee is looking at and the timeline and move forward. So whoever's working my agendas out, let's make that happen. Okay. Thank you, David. Anything else, sir?
No, that's it. Thank you so much for your time. And again, as a subject matter expert with lived experience with opioid use, I wish I could have brought you something more well put together as far as a presentation. I did the best I could with what I had, but I appreciate the conversation that we had during and afterwards. Thank you for your time.
No, all good, man. We're all working toward the same goal. So thank you for that. We'll move on then to agenda item number 6 for possible action, presentation, discussion, and vote to approve task force action plan related to bad batches. Ms. Johnson, you have the mic.
Wonderful. Thank you so much, Attorney General Ford. Jessica Johnson for the record. Good morning. I've been tasked with presenting today on bad batch apps. So I'm here as the Substance Use Response Group, the Surge Prevention Subcommittee Chair. Before I begin, I just wanted to give credit where credit is due. Many elements of this presentation were used with permission and gratitude from Alex Ney and the Northern Nevada Harm Reduction Alliance presentation at the April Surge committee meeting. So thank you for that. In the interest of disclosures, I'm here today representing my role on the Surge and at the request of the Joint Committee. In my professional role, I'm employed by the Southern Nevada Health District, and part of my salary is covered by Clark County's Overdose Data to Action grant. The details on the screen are here for your reference and transparency. Next slide. So by way of introduction, across the United States, communities have been developing programs to combat the epidemic of drug overdoses. That's not a surprise to anyone who's here on the call today. And one of the ways in which these jurisdictions are doing this is through issuing spike alerts, that is targeted messages that notify recipients that there's an unexpected increase in drug-related overdose in a specific area. These are sometimes called bad batch apps. The messages can be shared either via email, social media, even through direct SMS text messaging, and oftentimes are free to users of the application. And the purpose really is to reduce injury or death from overdoses, originally conceptualized for opioid overdoses, but could be more broadly conceptualized during spike events. And as I mentioned, one such type alert are these bad batch apps. The issue really that this addresses is around the increasing adulteration of within the drug supply, particularly presently of fentanyl, but being able to be nimble to other types of adulterants. According to the Nevada Statewide Unintentional Drug Overdose Reporting System, or SUDRS, illicitly manufactured fentanyl and fentanyl analogs were involved in 39% of statewide deaths from January to June of 2022. Which is a slight increase from the same time period the previous year of 34% of deaths in 2021. Drug checking is a crucial harm reduction strategy that has the potential to save numerous lives by providing individuals with essential information about substances that they intend or plan to consume. And through the testing of the composition, purity of drugs prior to use, these services can uncover harmful additives, unexpected elements, or potentially dangerous doses, depending on if it's a quantitative or qualitative type test. This has been demonstrated to enable folks to make informed decisions and steer clear of high-risk substances. Really, in the midst of the opioid crisis, identifying opportunities about the prevalence of synthetic drugs. These services can act as a lifeline, averting unintentional overdoses and adverse reactions. So by incorporating these types of processes into an application, individuals can access this type of knowledge more conveniently, more timely, and fostering opportunities to reduce both the toll on individuals experiencing non-fatal or fatal overdoses and within the various systems that might be impacted. Next slide. Oh, somebody's dog is barking. They're welcome to also chime in if they have things to say. Current practice. So there are bad batch apps that exist in multiple communities across the United States, in Baltimore and in Ohio. The one that is currently being looked at through the Northern Nevada Harm Reduction Alliance, and to the extent of my understanding, as was presented in the April harm reduction meeting through state provided ODTA dollars, is an application called Safety Outreach System, or SOS. This mobile application aims to inform people who might use it of drug batches that are associated with overdoses or fentanyl test strip positivity. This application would allow folks to sign up for alerts voluntarily, as well as report overdoses or fentanyl positive drugs from a fentanyl test strip. And this information would include the zip code in which these events occurred. This application would keep other personal information anonymous, and then would be able to create a bad batch alert that would notify folks who have signed up to receive alerts through a push type notification. This is based on an app out of Ohio called the SOAR app, which was developed by college students in Ohio for very similar purposes. On this screen, you'll see just some images for app reference of the SOAR app, which were courtesy of Alex and the Northern Nevada Harm Reduction Alliance. And as I mentioned before, my understanding is that the pilot version of this project does have some support from state ODTA dollars to get up and running in its development. Next slide. So gaps. So thinking through what's already in current practice in Nevada, really the literature has not yet determined from my look at this, the utilization or implementation factors such as acceptability, adoption, or reach among populations of focus, or the impact of such apps. These opportunities really exist as a way to best understand the role that these apps might play and are important to evaluate prior to scale up. We do know that there's a relatively robust body of evidence through fentanyl test strip evaluation studies and other sources that when people who use drugs are informed of the contents of their supply, most of them report a change in drug use behavior, such as using less, doing what's called a tester shot, changing the route of administration, or another type of activity which would reduce their risk for overdose death. Next slide. Populations impacted. So my understanding is the primary population that would be impacted by a bad batch app would be for people who use or people who inject drugs. A secondary population that's been identified in the write-ups from Baltimore and Ohio are around the social network, so friends and family of people who use or people who inject drugs, potentially peer outreach workers, and other populations who are disproportionately impacted by substance use. I'm aware on the surge we have a pretty extensive list of individuals who might be impacted by substance use disorders, such as veterans, youth, folks who are pregnant, LGBTQ populations, and other types of individuals who could potentially be included as part of this primary or secondary populations. So potential wide-ranging impact for some of the populations that both of our groups are focused on. Next slide. So I brought this recommendation forward as they align with the drafted surge harm reduction recommendations that were presented at the surge's July 17th meeting. This particular recommendation does include the supporting the implementation of the SOS app launch. Really the first recommendation would be around piloting and rigorously evaluating the use of the Bad Batch app in a particular behavioral health region or where the SOS app launch is currently happening. And then again, to rigorously evaluate some of those indicators through to really understand and determine the effectiveness and potential next steps for an app expansion statewide. And to scale up for the rest of the state. These are the references that I used in preparation of this presentation, and my contact info is on the next slide. Thank you.
Thanks, Jessica. So any questions of Jessica? I have a question, but I want to let others chime in first. Lisa.
Thank you, Chair Ford. Thank you, Jessica, for the presentation. Lisa Lee for the record. I just wanted to provide an update on what's going on with the Bad Batch app. So Alex has been working on getting it published and has had some issues. So I am asking all of you folks if anybody has expertise in publishing an app to an app store. They speak in a language that neither of us understand. I know it's English, but I have no idea what they're saying. So if anybody speaks geek speak app, right? Like the app version, I would love for you to contact me to help walk us through publishing it to the store. Everything is set up and that's just the barrier right now. So thank you very much for the presentation.
Thanks, Lisa. I'm glad you mentioned that because that bleeds into a question that I had from the question that Jessica was, what's the actual ask? Is the ask that we as a subcommittee or as a joint committee kind of get behind and advocate for and support the use of a Bad Batch app, number one, and then number two, what's it take to make it happen? And I think I have a follow-up to Lisa. So is that the question? Is that the ask, Jessica?
Attorney General Ford, thank you for the question. Jessica Johnson for the record. My ask today is I wanted to elevate the recommendation that currently exists through the surge prevention subcommittee. If the Bad Batch app is currently sort of funded, quote unquote, for lack of a better word, through a different source, obviously that would not be my recommendation, but my recommendation would be to support an opportunity to evaluate the impact of the app. So because that's currently a gap in the literature. So communities are deploying these types of applications, but they're not quite sure what impact they're having, who is using them, how they're using them to save lives. The opportunity here for Nevada to be in that evaluation space, so whether that's with an external organization or someone with that type of expertise who could talk with folks who are using the application or who have downloaded the application, roll out some surveys to understand the impact, would help inform scale up statewide. So is this something we should consider statewide? How is the community where this is being piloted, and someone on this call can help support that if it is all throughout Washoe County or if there's kind of a more of a narrow region. But my recommendation, if currently supported by funds, would be to allocate funding for an evaluation of the app.
Okay. All right. So to you, Lisa, and I want to be careful how I say this out loud, because what I don't want to happen is for this government committee to be considered, advocating a proprietary for-profit. I don't know what you're doing, Lisa, and I'm not suggesting you are, but what I'm about to say is my office may very well be able to connect you with contacts that we have with Apple. I don't know, I know people at Apple that we do correspond with that might be able to give you technical advice in that regard. But what I don't want to happen is the perception that we are, picking winners and losers. Am I making sense? I mean, you understand what I'm saying, Lisa?
Yes, may I respond to that, Chair Ford?
Yeah.
Lisa Lee for the record. So just to put it out there, I received no financial, this isn't a part of any organization or anything like that. It was literally 2 high school kids, one being my own child who had a service learning project and wanted to do something meaningful and took this project on. And so I think that's awesome that 2 teenagers were able to get this thing done that we've been talking about doing for a really long time. And so so that nobody's it's not part of any organization, nobody's making any money off this. And please evaluate it, do whatever you need to do. It really is in the spirit of service to the community as much of harm reduction is.
You know what we might do? Thinking of agenda items, and I'm asking TPT, who's on my screen here, and I don't know if Terry Kerns is or not. Since Bad Batch has come up several times, these apps, maybe it's worthwhile to have a 15, 20-minute presentation from app organizations like Apple or Android. Maybe come on and present and talk about this issue and ways in which those who want to engage in further conversation on how to effectuate it. Maybe we can look at that. Okay, so I'm just saying it out loud so my agenda folks can help me to think about the best way to reach out and agendize maybe that conversation, and that can help you, Lisa, and then y'all can do what you want to from there. Does that make sense? Okay, because Bad Batch has come up several times in Surge. And so I think I'm on good standing to be able to mention that out loud. So help me, for whoever's taking notes from our agendas, help me think of that too. Debbie, go ahead.
Debbie Nadler for the record. Lisa and Jessica, y'all are like my heroes. What you come up with. As far as the Bad Batch, what if, just a thought in my head, what if, since the kids are interested in this, which is awesome to hear, I'm sure we have some data programmers at UNLV or UNR or some of the college kids can help, because that gives them a purpose, that gets them into spreading the information to their peers. And also, as far as getting everybody involved in the Bad Batch app themselves, is this something we can do, like on the back of student ID cards, a QR code to the app or to something? I know in Reno, they have QR up north. I know where Lisa is, they have QR codes right now, or at least numbers that kids can call for help if they're experiencing mental health or a drug issue. But down here in Clark County, they don't have anything. But I'm just wondering if like a QR code on the back of their student ID cards that would tie them into the app or the services.
That's probably a bit more involved than we're prepared to discuss right now, because then you get into Nevada System of Higher Education policies and parental involvement, all other kind of stuff. But thank you for mentioning it out loud. We'll note it in the minutes for purposes of discussion at a later date if we can come up with something in that regard.
Yeah, thank you.
All right. Any further questions, comments for Jessica? I see Carla's hand up, and I think I see Lisa's hand just went up too. But Carla, go ahead.
Hi, thank you, Carla Wagner, for the record. I just want to mention the opportunity to align some of this interest in evaluation with the study that I mentioned earlier that we're about to launch. We are about to launch a 200-person cohort study and follow them over time. So I am happy to put a couple of questions on our survey to assess whether people are using the app or not up here. That would be very easy for us to do, and then it would be part of an IRB approved NIH-funded research study.
That sounds great. Thank you for doing that. Lisa and then Jessica.
Thank you, Chair Ford. Lisa Lee for the record. On that note, I'm also involved with that project that Dr. Wagner just mentioned. We did build into the actual Bad Batch app a place, related back to that study to just particularly look at people that are enrolled in that study and are using the Bad Batch app. So I think rolling that out to that specific group of people, it's a couple of hundred people, would be beneficial because then we really could kind of look at the ways in which people are interacting with that app. So it's already built in. Thank you.
I forgot we did that. Thank you, Lisa.
Thanks, Lisa. Jessica.
Thank you, Chair Ford. I don't know if this needs to be action or directive by this committee, but in light of Dr. Wagner's earlier point, I would be happy to work with her and her research team, if approved by the Joint Task Force, to identify an appropriate amount of questions around this to move an evaluation forward. With commitment to reporting at a future joint task force meeting regarding any development, if that's an appropriate thing to do. In the spirit of taking action on some of these items today, just wanted to offer that forward.
I think we can take action on that. Hina, am I right?
Yes, I think you could do that for sure.
Yeah. So I think as part of this action item of discussing Bad Batch stuff, Jessica, we can certainly entertain a motion for you to engage as you've just described, and I will accept such a motion. Somebody say so moved.
This is Elise. I will make the motion as stated by the Attorney General.
Can I get a second?
Debbie Nadler for the record, a second.
Any further discussion on this motion? You can say none. All in favor say aye. Aye.
Aye.
Aye.
Aye.
Aye.
Any opposed? Motion, any abstentions?
I'll abstain for the record since I volunteered to do it.
That's Jessica Johnson for the record. All right, motion passes. Thank you so much. I think we're done with this agenda item, all right, Jessica? Okay. So, all right, very well. Let's move on to the next agenda item, which is number 7, if I understand my Roman numerals right. Discussion of future presentations for action plan topics. Don, go ahead. I think we have at least a couple already, one of which is our PSA plan. And another may very well be, should be, in my estimation, if we can reach out to like Apple and Android and whoever else has stores to see if we can convince them to present to us at a joint level, because I suspect Acorn, which is getting a whole bunch of the $1.1 billion, might be able to utilize this information as they determine how to spend money as well. And the Surge Committee could certainly use it because we've talked about bad batches for a while. So at least those two things, I think, would be good future presentations for action plan topics. But let me open it up or give it back to you, Don, and you can lead this discussion.
Yes. Thank you, Attorney General and members of the committee. So a while ago, we actually had some action items under communication, harm reduction, access to care, as well as additional action plan items. And so I just wanted to go through those because we had completed a survey 8 months ago. We asked for individuals to take leads, and that's why you saw a presentation from Jessica today, and you saw a presentation from the chair today. Next slide, please. So just as a reminder, under communications, it was identify substances involved in overdoses quickly, connect public safety and local overdose spike monitoring agencies, which we kind of talked about as well today. Provide technical assistance, guidance, and resources to rapidly implement best practices to reduce risk for overdoses, enhance capacity to respond to events and recover should such an overdose occur, increase prevention in schools, which includes messaging, and then educate the public on the identification of treatment needs and treatment access and resources. There are individuals assigned to some of these. I just wanted to give you guys a moment to let me know, is anybody interested in presenting on any of these during the next meeting? Is your name on here and it shouldn't be on here? Would you like to be on one of these spots? So I'll just kind of open it up for discussion under the communications.
Thanks. Anyone?
Debbie Nadler, for the record. When you talk about for the increased prevention in schools, which includes messaging, I see I'm an assigned member to that. I'll be happy to make a presentation. I mean, if that's what you're asking.
Yes, that is what I'm asking. Thank you, Debbie. So I will go ahead and highlight that. Catherine?
Oh, I'm sorry.
Or Lisa?
Yeah, my bad. Yeah, Catherine and then Lisa. Catherine, you're muted.
I'm sorry about that. I'm interested in helping in the increasing prevention in schools and messaging in schools.
Great. Thanks for volunteering for that.
Thanks, Catherine. We'll connect you with Debbie, and then maybe you guys can work on that together and come to the next meeting ready to present with some recommendations for us. Thank you.
Lisa?
Thank you, Chair Ford. Lisa Lee for the record. That one identifies substances involved in overdoses quickly. I'm not quite certain what that means. Is this looking at drug checking methodologies and how to, what does this mean? I guess I need clarification. Is this specifically looking at drug checking?
I think it's however you want to take that one. So communications of identifying substances, kind of going back to not necessarily Bad Batch, but being able to identify and push messages out to the public for safety.
Okay, and so I'm assuming it could also relate to toxicology performed in hospitals, which I'm still uncertain which hospitals are even checking for fentanyl. I know that was a big problem up here where they were not. And so I'm assuming it would incorporate those data as well as I don't think EMS is checking, doing any kind of tox testing on people. And then post-mortem, that's kind of a big can of worms. Is that?
I think the more that you can involve in that topic, the better off, and the more specific that you can be as far as a recommendation or a gap will help this committee. And really tying it back to like overdoses and overdose prevention and post overdose.
So Dawn, this is Elise. I'd be happy to provide an update on the testing. The OD2A grant has kind of laid some groundwork I can talk to. And then also there was a really great presentation on the surge about wastewater surveillance that I think will be helpful. So I'm happy to take that one and can provide an update at the next meeting.
Great. Thanks, Elise. Okay, I'm going to move on from communications. Can you go to the next? Sorry, Lisa, did you have something else to add?
I did. So did you want me to work with Elise, or you want to take me off of that and assign it to Elise?
We can definitely have you guys work as a team.
Okay.
If you guys are okay with that.
Absolutely. Thank you.
Thank you, guys. The next area under consideration was for harm reduction, provide access to fentanyl testing, increase naloxone distribution, targeting populations in need using data including those using drugs, as well as, I guess, the MOUD clinics, including leave behind programs, EMS, fire, law enforcement, mobile teams, nalox boxes, use exchange sites for additional harm reduction efforts, and then create street outreach teams to provide street machine programs. I think it was supposed to be vending machine programs, harm reduction, psychiatry, and care management. Support and expand street outreach for harm reduction. Again, do any of these pop out to any of the members that are either assigned to this? Would you like to be somebody who is assigned to this topic? Do we want to hear more about these harm reduction topics as far as an action plan goes?
Hi, this is Chelsea Cheatham for the record. I am willing to do a presentation on the naloxone distribution or the use of exchange sites for additional harm reduction efforts. And then also going back to the communication slide, I currently work in prevention, so I'm also open to talking about prevention in schools.
Thank you, Chelsea. I'm going to go ahead and put you down for the naloxone distribution and exchange sites. We want to keep these little pods and committees to 2 people, just so that we don't run into any open meeting law in issues. So thank you.
Hey, Dawn, now that I'm looking at this slide and have the information from the other slide, I think the identifying the substances involved in overdoses quickly, I'm not sure if that should be on the communication slide. That being said, because it looks like it ties to providing access to fentanyl testing. So what I think would be helpful is for the harm reduction piece, if I include information about how best to message about testing and drug checking and things like that. How does that sound to you?
Elise, this is your committee, so however you guys want to form this and put these into actionable items, we're happy to assist you in your best practice. So
let's squish those together then.
Yes, if I could, Lisa Lee for the record, I was going to comment the same thing. Sorry, I had my hand up. About the cross-cutting elements between the access to fentanyl testing, which I think goes to the drug testing and thinking beyond fentanyl test strips. I think there's an opportunity to merge those. I would also suggest that kind of goes into the outreach, right? Because you can't get this to people without some sort of harm reduction outreach. So I feel like there's a lot of duplicative bullet points here that we could probably merge together. Elise, do you think that we could merge effectively using outreach teams with drug checking and identifying substances? Because I feel like all of those kind of go hand in hand, if you don't mind.
Yeah, that makes sense.
We'll do a mashup. Okay, cool. Thank you.
Okay, thank you guys. Next slide. And then we have access. So this is initiate buprenorphine in the emergency departments and during inpatient stays and education, support low threshold prescribing for buprenorphine treatment, as well as provide MAT in all adult correctional and juvenile justice facilities. Any comments on any of these?
Sorry, Dawn, Lisa Lee for the record. Ariana had her hand up for the last one. I just didn't want her to get missed.
Oh, I'm sorry, Ariana, I didn't see you.
Oh, no, it's okay. I actually, after Lisa's comment, I'm happy to defer to Lisa and Elise to handle the harm reduction piece, but I can offer assistance on best practices around outreach if you guys need it.
Awesome, thank you.
Okay, I see Debbie's hand up and then Jamie. Go ahead, Debbie.
Hi, Debbie Nadler for the record. I'm under the first one to initiate in the emergency department. I see my name is on there. I know Darcy wanted to do that. I don't know if she's on the phone or she was, but the Tyler's Law, I know all about it. I mean, I can provide somebody with information who wants to do it. I'd like to focus on the prevention in the schools, but that was my old partner who got it passed, the Tyler's Law in California, where they mandated the fentanyl testing when anybody came in. And I can help somebody with it, but I'd rather somebody else present it.
Thanks, Debbie. Duly noted.
Thank you, Debbie.
Jamie?
Thank you so much, Jamie Ross, for the record. I know that Catherine and Debbie were going to do the prevention programming. I just wanted to volunteer to support that. Actually, Anne Elizabeth Northen from JTNN and myself actually did a presentation on prevention programming in schools to I believe it was the Surge Prevention Committee about 6 or 9 months ago, and would be happy to share that, which has already been presented as well.
Okay, thanks so much. Any other comments on this one? Okay.
All right, next slide. And then these were some additional action items that were brought up in the last meeting. I think we are good with the training on the Good Samaritan Law, unless anybody else has anything to add on that one. And then to facilitate opportunities for entry into treatment and a recovery in order to ensure that Black, Latinx, Hispanic, Indigenous, and people of color communities are receiving overdose prevention, recognition, and reversal training, and overdose prevention supplies such as fentanyl test strips and naloxone to reduce fatal overdoses among disparate populations. I had Ariana on that one, but open for discussion.
So this is Elise Dawn. So just something to share for the benefit of the group. I think that we had really good conversation about community-wide training on the Good Samaritan Law, but I will tell for this group, the OD2A grant just did a training for public defenders on the Good Samaritan Law. One of our peers on our staff kind of put it well in a way that was impactful to our program staff, which is unfortunately right now it feels like the police are going to arrest you regardless of what the law is. So having frontline of public defenders who are knowledgeable about the Good Samaritan Law and who is protected under it and who isn't, because it isn't a blanket. There are some this is covered, this isn't, is helpful. So that is a CLE for public defenders or for lawyers, excuse me. But it's also on an asynchronous type of format. So we can share that with anybody who wants to see it.
Yeah, Elise, if you send that to us, we will make sure to send it out to this committee. Lisa?
Thanks, Dawn. Lisa Lee for the record. I just wanted to maybe connect Ariana if I could just shoot you a couple of emails. I know Black Wall Street is doing a ton up here. And I really think that they're hitting it hard with ensuring that underrepresented communities have naloxone access, and also just the messaging around being at risk of overdose, right? So Donald Griffin, one of the co-founders, has talked a lot about how people who use pills don't really see themselves as using opioids, right? And this is kind of culturally constructed with the narrative of who is an opioid user. And so I think he'd be a really awesome resource about kind of the work that's being done up here in the North with his team. Thank you.
Thanks, Lisa. Ariana?
Excellent. Yeah, thank you, Lisa. This is Ariana for the record. So yeah, happy to put together a presentation on this and welcome anyone who would like to join me in that fun joy, especially folks who could provide, like Lisa just provided, some information on what's currently happening. Because yeah, I'm not as connected to what's currently happening with providers right now, so welcomed support.
Awesome. Thanks, Ariana. Well, I appreciate everybody's time today. I think we have a good timeline of presenters for the next few meetings, and we will be reaching out to you guys all separately with some templates.
Thanks, Don. Are there any further questions, comments, concerns, anything on this agenda item before we move on? All right, hearing and seeing none, we will move on to agenda item number 8, a discussion of next steps for the cross-sector task force. I think I've done enough talking, at least, about the couple of things that I think are important for us to be moving on and relatively quickly. Chair Sanchez, do you have anything you want to add for this agenda item?
No, sir. All good to go.
Okay. All right. I think what I'd like to do is to, and I don't want to like move too quickly, but expedite our, a meeting sooner than later so that we can get moving on the PSA stuff. So I will, at a minimum, the PSA stuff. So I will leave it to our respective teams, David, to work with our schedules and figure out a way where we can get a quorum and at a minimum, get moving on the bad batch and PSA stuff that we've talked about today. Is that okay with you, David?
Yes, sir. That sounds good.
Okay. All right. Any further comments on this agenda item? All right. Hearing and seeing none, we will move on to the penultimate item of public comment number 2. Do I need to read all that again? Okay, here we go. You can do it telephonically at 775-321-6111. But I don't think I had to read all that again. So public comment number 2. Anybody have a public comment? Jessica.
Hi, everyone. Good morning. Jessica Johnson for the record. I wanted to make folks aware of a community event that is happening next Thursday, August 31st, is International Overdose Awareness Day in Southern Nevada. The Southern Nevada Harm Reduction Alliance is hosting a community event from 4 to 7 p.m. at the Chuck Meeker Sports Complex. It's the same location that this event has been hosted for the last 3 years here down south. They'll be providing naloxone training to folks who are interested, as well as hearing some testimonials from folks in the community who've been impacted by overdose, time to remember, and also a time to act. So thank you.
Thanks, Jessica. Debbie.
Thank you, Debbie Nadler, for the record. And to follow up on what Jessica said about the event, we are also holding another event. Tin High is sponsoring it. And it's going to be from 7 to 8 p.m. August 31st. It's a memorial for those that we've lost, and it's going to be, or anybody who's lost a loved one. It's going to be at Western Trails Park, which is off of, it's southwest. And I can share a link if you want. We have a memorial there for, we have some trees and memorial plaques for our loved ones. So that's open to everybody. Thank you.
Thanks, Debbie. Lisa.
Good afternoon, Lisa Lee for the record. Well, I guess I will jump on this bandwagon as well and provide information on the International Overdose Awareness Day in Northern Nevada. It is taking place this Saturday, which is August 26th, 2 p.m. to 6 p.m. at Teglia's Paradise Park. That is sort of straddling the border between Reno and Sparks. There is going to be a memorial wall, music, various speakers, a ton of resources and activities to commemorate the folks that we've lost. Hit me up if you have any questions. Thank you so much.
Thanks, Lisa. Any further comments for public comment? entirely unrelated to our topic today, I just want to let everyone know my office is holding town halls right now about the proposed merger between Kroger and Albertsons. There's a listing of dates on our website, and there's a survey you can also take. We held our first one yesterday and got some good feedback. So please look out for those. Let us know what you think about it. We're trying to determine internally how we're going to respond to the proposed merger. So with that, I will make one final ask. Is there anyone that's a public comment? Hearing and seeing none, we are adjourned, everybody. Take care. Have a good one, everybody.
Thank you.